Okay, guys. I can see we have some people that have joined. So I think we can now continue with the meeting or the webinar in this case. Let me just flash the tentative agenda for your suggestions on if you maybe need any modifications to it, so that we can save on the time as well. Okay, please confirm that you can see the screen and with the agenda.
Yes, we can see it.
Thank you. So this is tentatively what we are hoping for this 1 hour or less. We're just going to have a prayer, an introduction, then a CSODSC data extraction requirements and challenges. Then we shall have feedback and discussion about these requirements and challenges, and then the way forward about this particular webinar request. Because it was a topic raised by, I think, users from DICs and CSOs. So I think what we can do is have a prayer first and follow this. Do we confirm to adopt this, or are there other changes or suggestions that we can maybe put into this? You can just unmute, then say it out, or raise your hand, or just put in the chat, whichever works for you. Do we adopt this? Is this okay for now, for the time we have?
Yes, please. Let's see.
Guys, just to be clear, I'm hoping that this can be interactive because from before we've been having webinars in a form of presentation, and we have a lot of videos that guide usage in terms of the tracker data use and also data extraction and performances. But I think moving forward, the suggestion is we have more interactive sessions whereby you guys can put in your words. Please mute your microphone if you're not really speaking to us. So I'm hoping that we can have this as interactive as possible so that we can all benefit from this. So the idea for this webinar today is that you guys from CSOs and DICs mostly, as well others can also put in their views, of course, but I'm hoping that this is mostly targeting users from DICs and CSOs. So what you can do or have for now is that you can give us your challenges that you have, and then we can, attack those particular or, just respond to those particular requirements and challenges. So is this okay? Can we just continue with the particular agenda that we have? Someone is saying my voice is too low. Let me try to switch my microphone. Okay, so I'm just trying to switch to another microphone. Just a second. Okay, so I don't know, is my voice clearer now? Joyce, is my voice better now? Okay, we are taking a lot of, okay, thank you. Someone is Isaac is saying it's clear. Okay, thanks, Isaac. So let me just continue. So I think we're adopting this since you guys are not really responding to the suggestions for the agenda. Can we have a volunteer for a prayer? Then you can start off with an introduction of why we are here, then the rest of the items on the agenda. Volunteer for the prayer, please. No one is praying for us. You guys, I'm not going to pray because I see a lot of people online.
Okay, let's sum ourselves for a prayer.
Thank you so much.
Okay, Heavenly Father, we want to thank you for this day. We thank you for this moment, and we thank you for this meeting. Lord, as we convene together, we pray for the wisdom, and we pray for your Holy Spirit to guide us throughout. In Jesus' name we prayed. Amen.
Thank you so much, Edith.
Okay.
And okay, so guys, so the introduction is that there was an earlier request about us, handling data extracts for DICs and CSOs. It was a suggestion that wasn't, opposed at any point within the chat, that is the WhatsApp group. So we carried on with that topic for this particular webinar. But the point of discussion is that we are going to look at the challenges that DICs and CSOs are facing in terms of data extraction and them monitoring their performances. So I think what we can start with is if you can, by show of hand, or you guys can just unmute since we are not so many. We're about less than 40. So you can just unmute for now, or just raise your hand, and we can start with the discussions. So that you can give us or let us know what the challenges are exactly about data extraction, and then we can have the webinar, pointing to those particular extraction challenges and data use. Can someone just give us any challenges that you think are most important, or because I do want to just show you what we think you guys are facing without you guys giving your input. So you can just have like 5-10 minutes for this, then we can start off with feedback, because we also have something to show you, but we wanted us to first get your feel and challenges on ground. Okay, hope I'm pronouncing the name well. Kevin, is it? Your hand is up. How do you pronounce the name?
Hello, good afternoon, everyone. My name is Kevin Kijambu, and I'm monitoring and evaluation officer at Youth on Oak Foundation.
Okay.
At the Youth on Oak Foundation, we are based in Mulago and Kawempe. So my main challenge regarding data extraction is with regards to the pivot tables, the aggregate data, because I can extract, I'm able to extract using the line listing to extract line lists. And then, of course, when the line lists come, they indicate data of the organization unit that I support. But using Excel, I have some skills in Excel which I use to filter out my CSO, and then I'm able to see which to find out the data I want, which clients are in the system, which ones have errors, and then I correct accordingly. But when it comes to aggregate data, especially for reporting, because when we are reporting, we are required to submit, we are required to input aggregate data figures in the reports that we have, the templates we have. And I find it challenging because when I try to extract using I go to data visualizer, and I found that information actually in it is a YouTube video that was shared by us so I was looking through it and I was able to know how to extract using that data visualizer app. So because under data visualizer there is a pivot table option, so when I tried to extract that, it gave me data for the entire organization unit which I support, and there was no option. Okay, I failed to find a way of extracting only the data for my CSO. So that is my main challenge. With the line list, I'm okay, but with pivot tables for aggregate data is where I find the challenge. Thank you.
Okay, thank you so much, Kevin, for that submission. Anyone else want to handle all of the requirements and challenges at once, so we can submit all of them now? Anyone else?
That's good. Good afternoon, House.
Yes, please. Good afternoon.
My name is Shina Omucha from Edwa. It's
Yes,
just to
please.
add on Kevin's point. Like he mentioned, we cannot extract aggregated data. Sometimes you find that you're doing an annual report or a semi-annual report, and it is a bit hectic to go back to the line list and then to filter out from client attributes. So it is easier if we could extract aggregated data, especially for those long months and bigger reports, because it then becomes a bit hectic for us if we are confined only to the line lists app. Thank you. Over to you.
Thank you so much, Bisha. Anyone else? Kevin, is that an old hand or anyone?
New. Yes, I'm sorry for speaking again, but I forgot about I wanted to mention about the performance tables. So we also have challenges in displaying our performance in DIC, because I think it all goes back to the aggregate data, because we are sometimes unable to extract aggregate data. That's why we are not sometimes able to display the numbers, and we want to display numbers that are not verified in the tracker. So the performance table, the tables for showing data use at the DIC, we are having challenges because we are not unable to extract the aggregate data.
Okay, please. That has been noted. Anyone else? Before we start handling these challenges and requests. Rachel, please go ahead.
Good afternoon, Alf. My issue has always still been data extraction using the line list, as it always brings me blanks somewhere, somehow. For example, one time I tried to extract data for Apple, then I entered encounter at status all, initiation, refill, and all that. Then it just brought me refills only. It didn't extract the initiations the way I wanted. Yet during selection, I put all. I didn't select only one. I don't know why. And even sometimes on Prep New, you may find that after selecting, like if you select all of them, it can bring you refills, and then initiations it doesn't bring. I don't know why. Thank you.
Hello, Ausi.
Oh, but apologies. I've been on mute all along when I've been talking. Sorry. Those are the challenges of online meetings. I think I'm used to the physical ones now. Apologies. Let me just say it again, and I hope I don't lose out on the content on what I had communicated earlier. So, most of the submissions have been related to challenges in data extraction and mostly to do with aggregate data. And I can see that Kevin or Mugisha are mostly having challenges with data extraction. And I can see in the chat that someone was saying that I'm too speedy, and I'm apologizing again. I'd apologized before, but I was on mute. So the thing is, I've just had lunch, and I think I'm a bit more energetic now. But later, I'll go slower because the system will get a bit bored with the food I have. But apologies on that. I'm going to try it and slow down a bit. So besides Rachel's challenge, which is relating to mostly the line lists on having maybe some blanks on some data elements, most of the challenges are coming in as extraction challenges for aggregate data. So one of the challenges that we've been facing on our side on providing data for CSOs and DICs is that, remember, aggregate data mostly relies on indicators and program indicators. So it being that we configure these indicators based on particular data elements and attributes, it was a bit bulky for us to actually provide indicators for all the CSOs and DICs in the country. We have hundreds of you guys, so us having indicators per DIC or per CSO was going to make the system, a bit high trafficked in terms of what you guys are going to be fetching out, and the performances might be affected as well in the long run. So what we've done so far is that, and I'm going to display this as well, is that at the moment we have constructed generic indicators for DICs, but the only challenge, and I think this was a discussion with JK, Joseph Chiragana of Rome, and we realized that because some DICs are attached to more than one facility and vice versa, or even a facility can have more than one DIC or CSO, it would be a bit challenging for us to actually depend on these particular generic indicators for you guys to have your numbers from the system in terms of aggregate results. So what we were hoping for, and this is up for discussion since we are all here, is that I can show you some of the indicators that we've constructed for DICs. But the idea was this: if you can have a generic indicator for every data in the system, then we have like data for maybe a particular DIC. So your role would have been maybe to go to a particular organization unit, extract a particular indicator with the DIC as maybe a prefix or suffix in this case. Then you would have your numbers. But now challenge is that some of you are sharing facilities. So it would be hard for you to know which numbers belong to a particular DIC or CSO. So I think most of those that will be affected are those DICs or CSOs that are operating within Kampala or within the central region. If I'm wrong, correct me if I'm wrong, but most of the DICs or CSOs from the discussion we've had before, like I said, I think the upcountry DICs might be benefiting from this indicator more than those in the urban areas. So the plan is for us to maybe there are some extracts that we've made, but let me share my screen. Let me just show them on my screen here. Let me just get the screen to you guys for you to see. Okay. Please confirm that you can see the tracker screen on your end.
Yes, we can.
Okay, so I'm just going to go in directly just to show you what I was talking about so that we can get better guidance. And as well, Joseph Chiragana will come in just to show you how you guys can utilize the line listing app for actually to get your performances from the system. But so far, let me just go to the dashboards. So there's a dashboard that we've created, and this is strictly or specifically for DICs and CSOs. So when you go to your dashboard, come to the top left corner and go to dashboards. For those of you that haven't used the dashboards before, in a while, you realize that the interface has changed because we've made some updates within the apps themselves. So the interface is slightly changing, but this is to improve your performances and utilization of the system. So the dashboard is called CSO stroke DIC performance, and in the brackets we have MOH. This is the name of the dashboard. So once you go to your system, you just go to dashboards and look out for this. So this is what we are hoping for, that we can utilize this particular dashboard to add on the indicators that you want to use for your data, extractions. And what we have so far are just a few extractions, but maybe we can build on this. But this is a start, and we can have more further discussions of this. So you can see that now we have like DIC major indicators, and we have them for the last quarter. Beauty is that for any extraction that we have here, these will be like official extractions. But what you can do, if at all this doesn't fit into your request, you can just go into the particular extraction and customize it to your needs. So it's easy. What you do is just come to any extraction of interest. Say if it was this, and it has maybe the data you need, because you see all of these indicators according to DICs. All of these are strictly for DICs, okay? As you can see, and the list goes on to the right side. These are all for DICs, but they are generic for all DICs. Like I said, they're not particularly, or they're not specific for a particular DIC. So what you can do is maybe just utilize this and add on other indicators and manipulate it anyhow that you want to. This is if it can work for you as a DIC, and this can mostly work for those that are sure that it's the only DIC that is maybe providing services for a particular org unit. What you do is come here and go to view it as a chart. Or no, you open in Data Visualizer app rather. And then once you're there, it will open up the default extraction as it was made from the start. So what you do is just come up and manipulate these particular configurations for the dimensions. Like for instance, if you wanted to add more program indicators, you just come to data and add in whichever indicator you have of interest. You can just look it up and add it into the system or remove what you don't need, okay? But we just thought that we could add the major indicators that have been constructed for DICs for you guys to be able to extract something at least from your side. So if this works for you, like for those guys that are up country and they're sure that it's the only CS of a facility, then you can just easily come to org unit, select whichever. So by default, it will have user org unit. So it will extract all the organization units that are attached to your particular account. But what you do is uncheck this and then only select the facilities that you're interested in, okay? So for example, if it was only HIS facility that I was interested in, for those with multiple ones, they will have a list of all their facilities, okay? But what you do is just select one or two or more that you're interested in for your extraction. So once you're there, you can just click on update and it will just give you your data for your DIC. These are now the indicators. But if you as well, give us feedback if there's any indicator that is really needed for a particular DIC. You can also let us know so that we can as well add it on the list. But for now, this is what we have for DICs, and we are adding more with time. But with your feedback and suggestions, we can improve on these dashboards and extractions. So like I said, this works better for those that are up country or maybe are sure that it's only DIC in a facility. But for the central guys, mostly, I think you can mostly utilize maybe this other one now. We thought that we have a line list, okay? But within a line list, you can as well add program indicators or indicators. But now the only thing is that you will have some more work to do within here. As an example, as you look at this, this is a generic line list, individual level data, but with indicators. As you can see, we have HTS, PPs, we have KP indicators, and so on. And you can add as many. We have Prep CT, but these are generic. The only difference is that once you use this, okay, what you do is that you can just, again, open it in line listing app right here, and it will open up the default extraction for you. So if at all you think that maybe this can as well work for you, in the meantime, as we plan on getting this better to serve you. So what you do is come here, okay, again, go to org units and specify your particular org units that you're interested in, okay? If it was only this, you come to this and update. It will only extract data for that org unit. But remember, in this case, if at all a facility has multiple DICs or CSOs, all of them will be listed in here. Like you can see, okay, so here we don't have. So what you do is come to the filters, okay? You see we have a column of drop-in center name, follow-up drop-in center name. So whichever you're interested in, drop-in center name, the difference is that for this particular one, for those of you that have been following up on our tutorials and our guides, there are attributes and there are data elements which are different. So for a data element, it will be from the stage where you provide services from. An attribute will be from the registration page. So some of these are attributes and some of them are data elements. So you need to be sure which data elements you're going to handle. And in this kind of way, as well as Rachel. Oh, I hope I'm not too fast again. I keep forgetting. But since we are recording this, you guys can play it back later when we upload it to the portal. Apologies again. So Rachel, as well, your issue I think can be partly handled within here. So I'm thinking that you might be using the wrong values, okay, or variables in this case. So as an example, if you fetch a drop-in center from the registration, which is an attribute, it will give you wrong result. If I told you want to look at maybe service delivery, but you have to make sure that whatever data element you're pulling out is from a particular stage. For that to show is that what you do is when you come to program dimensions, we have types here. So we have data elements and we have the program attributes. So if you selected an icon that has this program attribute, what it will give you are results from registration. But if you need results from service delivery, those are the stages: encounter, prep screening, or exit. You have to make sure that what you select has this particular icon for data element. That is very important for extraction. Otherwise, you'll get the wrong results. I hope I'm clear on that. So once you're here, you can easily manipulate this, adding even more generic indicators. But the only difference is that if you're sure that you are extracting data for follow-up or for service delivery, what you do is that sorry about that. So what you do is that you come up here and then look for the particular element or dimension of interest. Like for instance, follow-up drop-in center, it will mean that that is the drop-in center that was providing services at encounter stage. However, we still call it follow-up. I was meant to change this to actually encounter. Because since we don't have a follow-up stage anymore, and it's now called encounter. What you do is come to this, look for that particular item name within the list here. So which is this? So you click on follow-up drop-in center name. Okay, you see we have all of these particular drop-in centers. And that's what I said, that extracting, having indicators for all of you guys, you can see the list is still going. This could be a little, bulky for the system. So what you do is come here and filter out your particular DICs of interest. As an example, if I said maybe, which is our work, which ones do I have? I have our work by head now. I can just say our work, which is Alliance of Women Advocating for Change. So what you do is just tap on that, double tap on it so that it comes to the side of selected options. And so once you update, I don't know if it has any results in what I have, but once you update, it should only give you results for your particular DIC. Now, the additional work is that, unfortunately, it doesn't have, but let me just change it to something else. This is just random data, so it won't necessarily have the information you need. So, but for the sake of the example, as I don't know if these have, let me just try to fill some of them. Well, they don't. Let me just add all of them just to save on time. But this is just about you getting the idea. So let me just put remove everything so that it gives me all the data from the system without it having any filters. What's the update it should give me? So from the list that I have, if at all there was any results on this side, it will be shown in the list. So what you do is just download this entirely, and then you have to do filters within an external application like Excel or something like that. So you come to download, go to CSV, and then download by code. Or you can use the name, but the code is a bit shorter for most cases. For that is for the titles on your extract. So once it downloads, like this one here, I'm just going to open it in Excel. Okay, it has opened on the side. Let me drag it back here. As you can see, this is the data that we have. But now, it have put filters that remove all the data elements, unfortunately. But let me see if there are any drop-in centers. So, but the idea is for you to get the logic on how you can actually, there's a pack DIC here, and for here we have blanks. Oh, Okay, I think I need to go into how I actually extracted this, but the idea is for instance, if it was many DICs in the list, what you just do is come to the filter and only select what you want as a DIC or C in this case. So once that is done, it will just give you a list of all your DICs or CSOs within the system. And what you do is now look at these different indicators. To start with, it will show you a 1 for HTS. If at all this particular client qualified for HTS, TST for that period, it will have a 1. If it's a 0, it means they don't qualify for that indicator. So I don't know. Okay, so there's a 1 here. For instance, this client qualifies for KP-Prev for that period, okay? That's why you see a 1 here. So it means that what you're going to do is have a pivot extra generated from this data, and you can look at your indicators in terms of which data has ones, and then you eliminate the zeros because the ones are those that qualify a particular indicator. So once you have that, that can just help you have your numbers from the generic indicator for your CSOs or DICs. I don't know if this makes sense, but please just give me feedback. And I think for the sake of time, I'm going to ask JK to give us a guide on how we can actually utilize the line listing app for us to actually get data out of the system. And after that, we shall have feedback and also see if your challenges might be, handled within this particular hour. And if not, we shall carry on with the conversation online and within the portals. Joseph, are you on?
Elsie,
Yes, please.
hello.
Yes, Joseph, we can hear you.
Okay, good afternoon, everyone. Elsie, thank you so much for the initiative and thank you so much for the preliminary session you've taken all of us through. And thank you too for re-emphasizing to the DICs that the challenge we have about extracting DIC specific data through aggregates is because we do not have those direct indicators, and the fact that for metropolitan DICs, where we have multiple DICs supporting a single facility, a case of Kampala, Wakiso, and Mukono, for starters, is that you need always at all times to know who contributed what, and that is why the line list app becomes the way to go for the metropolitan implementers. Upcountry DICs, like you stated, it is a little precise. A DIC per facility or per sub-county, at times per district, meaning any contribution by DIC in a district is attributed to that only DIC available, which is a little different from the scenario in Kampala. So I would love so much to see if colleagues have any concerns or any comments on your submission. If not, we just do one generic example and then we can call it at that. I don't know if that is okay. I'll see if anyone can unmute and share if they have more questions in line with your submission. If not, we look at the generic line list and we go to Excel and do a few actions here and there to see something like a cascade.
Yeah, that should be okay. Team, please give us a feedback before Joseph starts with sharing his screen. Are there any challenges that you face from my presentation? Are there things that we need to improve? Are there, I don't know, any suggestions, please, before Joseph comes in? I'm going to take the silence for that everything is okay. And you guys will not complain after here, right? Okay, Joseph, I guess we are good to go. But you can also drop it in the chat.
Right.
Oh, Mary was saying that I requested to increase on the font. Oh, font, sorry. It's a bit late now for me to. So I saw your chat a bit late. Joseph, I think you'll use a bigger font moving forward. So I think you can continue, Joseph. Thanks.
Austin, I think you can put down your screen. I share my screen, and then we try to do something together as the team follows through. Then we see where we need to improve here and there. May someone confirm if they can see my screen?
Yes.
Yes, Joseph, we can see it.
All right. So so colleagues, like we earlier stated, for us to be able to see our contribution by facility as dioceses, mostly those in metropolitan areas, call them towns, we shall need to rely on the line listing application. And the application is right here with us. We shall use the training instance for us to be able to work out a simple cascade. And then we go to Excel to see how to further manipulate it. So once you select the line listing app, the time it takes to load depends on the quality of network you have and the bandwidth you have. I think where I am, the network is not so bad. So there we are. The system has taken us to the line listing application. And within line listing application, we have the 3 columns. The first on the extreme left, as which application you are in, that's the line list, the input type, and then the various dimensions. The middle column has the 2 forms of data extraction we can make. It has the event, as we all know. Most of the business in the tracker is event driven, and then the enrollment, where we can equally extract data across multiple programs within the track. And then the extreme left, right rather, is our display as usual. It indicates or it shows whatever we've run or whatever we've extracted once we click on the update. So we shall select the program as HIV prevention program. And most of our business we do is under encounter stage. That's what we shall select. However, if at all you need to look at individuals screened for PrEP eligibility, you can be good to stop at looking at the stage PrEP screening for substantial risk. However, from some of the complaints we get, some of us forget to change here to encounter. Then we start looking for data elements and program attributes that are found in encounter when we are at PrEP screening for substantial risk stage. And we never see them, and we tend to think the system is not acting properly. So we always need to be keen to know that the particular stages have various data elements and attributes that they shall be able to return. Thereafter, we go to program dimension. Under program dimension, we are able to explicitly define our query, what we need to look at, starting with the very first, the organization unit you want to look at. And by default, the system gives you access to all the facilities you have access to. Call them organization units. So to be specific, you need to uncheck the default selection and select a particular facility of interest. Let me take an example. In Kampala, I can choose to work with Rubaga Division, and perhaps I go to Kawala Health Center, assuming that is where I need to see the performance. Maybe I'm looking at a work. So I select Kawala, and then we encourage you hiding, because once you keep updating, the system shall take some time running whichever filter you've applied. However, when you update, the system will run the filters at once, and then data shall be returned. So you hide, and event status, we can leave it at default. Program status, we can leave it at default, and we run direct to other variables that we need. Many of us have always wanted to know which individual is on appointment, who is coming back when. We can always look at appointment date. Individuals who have been registered when, we can look at the registration date. And then the rest of what we need to know about date is under the encounter date. Speak of art initiation, the encounter date for that event is the art initiation date. Prep initiation, the encounter date for that event is the prep initiation date. So we no longer have those variables like art start date and it comes independently. Prep start date, no. Going forward, just select the variable, the data element you want to look at and pick the encounter date when it occurred. So you shall be seeing when the activity happened. So for this partial extract, let us consider the past 1 year. Since it is a training instance, we may not have so much data for a shorter period. And so if you are to specify your particular period, you click on the icon of that variable or that dimension. And once you open the one for encounter date, you have both relative and fixed dates. And for this particular one, let us do a fixed date, since many of us know how to find the relative dates. When you go to fixed dates, we can choose last year, and then whenever you change that, even the months given to you, all the quarters, if you decide to look at your data under quarters, they'll keep changing the year basing on which year you've selected under year. So let's look at 2024 by month. And we can choose to take all of them at once. We'll click on the double arrows or return everything at once when you click on the arrows facing the left, or choose to take one at a time by double clicking, or one at a time by selecting and clicking on a single arrow. And so is the returning. This we are quite sure we are all aware. These are basics we've always gone through. So we can choose everything for the year 2024, and then we hide. Thereafter, we wish to look at individuals that tested, those that tested positive, negative, that had a screen for for PrEP, those that initiated, and those that started art. And perhaps the viral load status. And these are the common variables that we need to look at in our cascades. So given that we are looking at raw data, the way it is entered in the system, we shall not look at this data as program indicators. This time around, we need to look at data elements and all program attributes where needed. However, since we need to be versatile in our extraction, it's encouraged that we leave it at all type, and then what you punch in is what spells out what you're looking at. When you filter data elements and you're looking for an attribute, you may have issues finding it. And before you remember that you had put a different filter, you're already calling out for support, thinking the system has a challenge. So we can start with HIV testing. We look for the data elements, HIV results. So under HIV results, if you're interested in those that tested only, you have liberty to click on the icon and select out the positive and negative per se, and then take those as those that had a test. You can equally hide that. When you want to look at art initiation, still we shall look out for art status as the variable, and within art status, we can check out for either initiation, or we take everything, and from the analysis we make in Excel, we can spell out that we want to look at only and only the initiated. If you want to look at just the initiation to see your linkage, you can click on the icon and select initiated on art and take. If you equally want to look at those that refilled, you can equally select refilled, and that you hide. So one aspect I skipped out is after making our selection, you need to hover and look at the extreme right of whichever variable you've filtered out and select it. That's why you are not seeing my selected variables coming up here, because we hadn't clicked on the plus sign and to have them come to the selected. And equal to remove, you still hover at them. If it is already selected, when you hover over, you shall see the negation sign that can pull them back. And so I have to take the art status as well as the HIV results that I filtered first for us to be able to see this when we do when we update and want to see what comes out. Being in a line list, it is paramount that you look out for the unique identification for you to be able to do the other recures. So you can look at unique identification code and generator. Thereafter, we can also want to look at sex of the individuals, sex at birth. Since we want everything under sex, you can just click on the plus. If you are interested in age group, all age in years, you can equally select it, age in years. You click on the plus and it will go. Thereafter, we have looked at HIV status, at status, HIV results. Or we had also wanted to look at PrEP initiation. So under PrEP initiation, the same thing applies. We look at PrEP status. PrEP status. And if you are interested in those that initiated only, you can click on initiated, select it, and drop it there. Otherwise, you leave it at default and take the entire variable or data element for the system to return whoever has any form of PrEP status. And then we also look at viral load results. Viral load results. Viral load results. Viral load.
That is a PVLS, JK.
Oh, you capture it as PVLS.
Oh, wait, you're looking for the result itself?
We are looking
sorry.
at
I directed you. Sorry.
data
Apologies.
element.
Okay, apologies.
It should be viral load. Okay, now I can specify that I'm looking at data elements to make the search a little precise. Yeah, result of viral load test. So those are things to keep trying out. When I left it open, it was giving me a lot and I wasn't seeing what I want easily. When I filtered out data elements only, the results of viral loads have been filtered out among the so many. So we can add them there. And then the other, given that we want to look at DIC specific performance, then we can also add in drop-in center name. Drop-in center name. Also, has it been harmonized to just this? We dropped the prefix or follow-up.
Yeah, now that is, you can see that it's under data element, and we had the other one which was under program attributes. So if you do program attributes, first select all.
Get you. Yeah. That I was looking at. I was interested in the one which is open. Drop-in center name. So in here we have two. One will only pick for attributes, and one will show up in data elements.
Should we add the word encounter on the data element one, just to avoid the confusion?
I think we need to spell out such that whoever is extracting is able to tell what they're extracting. Because even right now, You can
Well,
only
they have the
rely
same
on
name, but you can see that
on the
that the
icons.
type is different. So if someone misses out on the type, they might get wrong results. I think we
Yeah.
are going to add the word encounter on the one for data element. Okay.
Yeah,
Please
but the
continue.
one which is encouraged for colleagues, the one for data elements is what would encourage to use because it will capture all over. The one for attributes may only end at registration or baseline, since that's where most of the attributes end. But as agreed, House is going to make the adjustment to spell this one out that it matches with the encounter stage. And even in there, if you want to make out filters for a particular drop-in center, you click on the icon and filter out that maybe you need to look at Alliance of Women, that is our work, and then you can select it and drop it there. Good enough, this is dummy data. It does not point to any specific performance. So we can able look at, maybe you want to look at empowered. You highlight it, drop it there. And then lastly, you may also want to look at maybe Kuchu. You highlight it and drop it there. So assuming those are the three drop-in centers, we just need to look at their performance under Kawala Health Center. So we can hide. Hey, sorry about that. Sorry about that, colleagues. There's that cut back, but we can run very fast and go back to where we were in the next 2 minutes because we are supposed to be done in not more than 5 minutes from now. Let's just select any facility. Link line still Kawala, but the process remains the same. Okay, let's do Chitebi. I see Chitebi first. Then we run to HIV results. We hope this time round HIV results. Hey, why is it acting this way? Sorry. Just like I said, once you forget to change, it always limits you on what you can see. HIV results. There it comes. Then at status. There it comes. Prep status. It comes. Then we look at the drop-in center name. It comes. We had said we look at the entire 2024 and fixed period, and then it is month 3. Okay, month 3. Last year, 2024, take everything, hide. Drop-in center, we should not specify. Let's just look at this, given that we have run out of time, and then update this, and we see what it gives us. Dimension did not return any data. There may be, I don't think it's a data issue. Kampala. Can we select Kawala? We did. Yeah, rather Chitebi. Let's try Kawala. On top of that, Chitebi first did. Oh, it still says no data. HIV results. Everything is there. Add status, everything is there. Prep status, everything is in there. Drop-in center name, we selected all drop-in centers, meaning it would bring everything. Should we think this training instance doesn't have data for DICs? I would wish to think that way. You can switch to the live system and see. I'll see. Hello.
Hello, can you hear me?
I can't hear you now.
I'll say that we tried the live one. I think that has some gaps on the data related to that. Let's try the live one. Apologies for that.
Yeah, let me switch even location. And I let this other engagement continue. As we look at the live system, you see if it has some data.
So I have like 10 minutes here, then I can come. I don't know if I could.
Yeah, I'm on the live now. Let's look at it very fast. We still go to the line listing app. And then same procedure as we were in the other. Okay. Log unit. I don't want to do a lot because Kampala is a lot. It will take us time. Just want to be specific. Kawala. Okay. Visit date. Okay. Hide. HIV results. Unique. Okay. Add status. Dropped in center. Okay, thank you. I think we can just use this. So maybe let's add in prep status. Even time we may not do a lot. Prep status. Can add that. And so registration date for org unit. Org unit still has the entire Kampala. No. So we can run the update and see. Okay. So here we are blessed to have results returned. And so from here, we encourage colleagues to download as a CSV name. And then once you download as a CSV name, you in position to view this data in Excel. And then you can manipulate it the way you love it best. And once it is in Excel, please confirm if you can see my Excel page. Gina, can you see my Excel page?
Yeah, we can see it.
Okay, so from this extract, we are now in position to run a basic cascade. We've not had everything, but at least it gives us the basis. And now, given that we have two ID forms, or rather two of IDs, we can concatenate the two IDs, create one ID. And now it is that one ID for which we can base our analysis, for it shall be catering for both those that have the unique ID code and those that are auto-generated. So we can call that joint ID. And then it is a concatenation of the unique ID code, because you realize the sample without unique ID, but they have auto-generated. Perhaps there are also those with auto-generated without the unique. So not to leave out anyone, we can do that. And then we can have that joint ID for analysis purposes only. And then thereafter, we can ably do a simple pivot, since most of, sorry, I didn't applied the concatenation to all. We can now do a simple pivot to know how many tested positive. Then we can also do another one to look at initiation, then another one to look at prep insertion by drop-in center name. So we can insert a pivot table, and then it's this pivot table that we shall now use to have our analysis done. So under pivot table, we can do drop-in center name. And now here, I would love to hear comments from colleagues. Oh, it's limited to Kawala. It has a few drop-in center names. We continue to have some weird drop-in center names, and we wonder who is doing that. Then we can also have HIV results, and then we can have our joint ID as the value, and so the counts can speak to. So whichever is under blank, it means those are the efforts that the facility incurred without the support of the DICs in that particular facility. Remember, we are looking at Kawala, meaning in total, Kawala had 504 negatives done strictly by facility intervention. And then LedMamed supported that, Empowered supported that, Alliance supported that. And then now this one's a weird one. AIC in Kampala. It's quite weird. So the positives there, as you can see, there are 11 positives under our work. The rest, the other 13 positives, they are under direct support by the facility. We picked a few variables. We cannot do by sex, we cannot do the others, but you can equally copy this. And then instead of now HIV results, you can drop their at status. And you remove the HIV results. Then you also have a table for at status. So we have 11 initiated under work, and also remember they have 11 positives, an implication of 100% linkage. So when you're adding up these columns into one cascade, you pick the sum of positive and negative to do your HTS-TST, then the positive to do the pause, then the negative to do the neg, then the initiated to do the initiated, of course, the TX new, then you calculate the linkage, and then if time could allow, actually, we'd also do that, but you all know we're supposed to work within an hour. We've already pushed beyond an hour for the sake of having this particular presentation made, but it would also be nice for us to look at it that way. But it's good enough we are still together. We can always do this time and again. Then for prep, this is the initiation, these are the refills, these are the stopped, and these are the blanks who do not apply to prep. So when you consolidate these three tables, you can make a very nice cascade by picking a column and put it in your cascade where it applies appropriately. Also, due to time, I don't think we need to go beyond this. We can always add on in the subsequent engagements, but I think it can provoke our colleagues to build it up from here to equally go in the system and do extract and provoke themselves to analyze at different fora, whatever they want to look at. If there are any questions, I think it's the time. Else, I hand over back to you. Thank you.
Okay, thank you so much, Joseph. This was, I think, beneficial to most of us. And Tim, We are 10 minutes past the hour that we had agreed upon, but because it started a bit late, I hope you can allow us to extend some bit of minutes. So we've concluded on the webinar today, and I think if you have any questions, suggestions, or any feedback for us, this is the time so that we can close the meeting and have maybe suggestions for the next webinar. Any suggestions from you guys before we close? You can unmute, or Jackie and Nagwija Aida, please mute if you're not speaking to us. For the rest of you that want to speak to us, please unmute and talk, or just raise your hand, or put in the chat as well. Any feedback? I can see in the chat we have that will suffice. That was Kevin. Voice is too low. I don't know if this was me or Joseph. Very clear. That was Isaac. Yes. Oh, sorry, I'm reading from before. Someone was saying request that you increase on the that was from before. So Edith was just saying thanks for this webinar. It's been helpful. There is no other messages in the chat. So I think unless someone wants to say something before we close, but because we are late, I think we can call this a close. So Joseph, this has been elaborate, and I think people have benefited from it. But for those that would suggest maybe an extension of how to manipulate data out of the tracker, we can maybe suggest this as a topic for the next webinar, and we can have it elaborated more on the next hour for the next month. So please put your comments in the chat for WhatsApp and the portal, then we can engage the other team members to also suggest on how we can improve on our data utilization. For now, if there's nothing else, Joseph, thank you so much. And team, thank you all of you guys for participating and for your feedback, because we rely on that to improve the system. Until the next one, please just keep in touch via the group and other portals. Have a great afternoon and the rest of the day. Bye-bye.